It's infections of the hair follicles, again causes by the Staphylococcus aureus. Like this, the lesions you can see in the follicles. You can see the redness and the infections. And superficial folliculitis, Burkhardt impetigo, it's calling, just like impetigo, small bullets you can see, mostly on the back of the buttock areas where there is warmness, the humidity is more, you can see it. And it is caused by the Staphylococcus aureus. Here also back, when after for the females, after the head bath, the hair is not that's drying fastly, can cause this. And after also, and those who are using their towel to tie their that hair on the back, that also causes this. It's trigger the infections. And psychosis vulgaris is another condition because on the hair follicles, the recurrent infections comes there, and it forms a raised plaques with the more pustules in the particular area. Sometimes we may be confused with some of the fungal infections, but ask them for the history and just see the margin. In the case of fungal infection, the margin is very demarcated, very clear, where these fungus are arranged like a pearl in the surroundings. You can see that. But in the case of this bacterial infection, it will be raised, having the pustules in the middle, but no demarcated margins you can see. The same hair follicle area you can see. Okay. And psychosis vulgaris is again on the beard area. Sometimes, again, we may confused with the tinea barbae. So, examine for the margin and go for the treatment. And pseudofolliculitis. And the penetration of the bacteria in the particular area, but no hair follicle, not in the hair follicles, no other areas. Sharp tips of shaved hairs. Ferrugosis, that is boils, as against staphylococcal infection. If it is only one portion, only one opening, it's ferrugosis with multiple, it's a carbuncle. There's a furuncle, only one, you can see a single pustule in the middle. Two openings you can see. One furuncle changed to carbuncle form. Okay. So here, if the boil is not breaking, the boil become hard. No pus is coming. It's very hard. You can use pacha, padha, ekanayika. You make boil with the buttermilk, make a paste and apply over the area. It will break and the contents will exudate from the opening. And eladigana churnam, you just make a paste with the kshiri vriksha kashayam, and that paste you apply with honey on a particular area. Again, it helps to break the boil and removes the exudate from the inside and helps to clean the boils. And if it is associated with more pain and more than 3 or 4 pidakas are there, you can go with the Karaskara Moola Kshiri Vriksha Kashaya Dhara. So continuous dhara can also helps to break the pidakas and clean it. Another yoga, Karaskara Pallava, added with the cooked rice. These two, cooked rice or the soaked rice, and boil with milk, then grind it, make a paste, mix with butter and use for the external application. That's a more paitiga, more redness, more daha, more pain. If you want to break the pitaka, you can use this Karaskara Pallava, rice, soaked rice, boil in this milk, make a paste, add it with butter and apply over the, not a single time. You apply this, keep it for half an hour or 1 hour, just remove it, leave it for half an hour, then again apply. Remove the first layer and leave it for half an hour. Then after that again apply. The 3 or 4 or 5 times application breaks the pitaka and cleanse it. And the another kashayam you can make use in this condition is Gopangana Adi Kashayam. That's Gopangana. That's a Shariba, Kamala. That's lotus. Chandana, Sevya. That's Ushira. Vishwa, Shundi. Eshti. That is Eshti. Licorice. Utpala, Madhuka, Shatavari. This kashaya, make the kashaya added with honey and siddha, you can give. So if more pitakas are coming, more paitika, more spreading in nature, this Gopangana kashaya we can give along with Gopi Chandana Gulika or Sudarshana Gulika or Sudarshana Churnam and Avipatti Churnas in Itivirajana also you can give. If the pitaka is with maggots, so you take the Karaskara leaf, Kuchala leaf, Karaskara leaf, make it a kashaya and do dhara. And the same leaf, cook it and apply the leaf on the particular area. It cleanses the wound, removes the maggots from the particular pitaka and cleanses the wound. Okay. So the Karaskara patra kashaya for the dhara and the cooked Karaskara patra lepa external. Okay. And this is the infections what we had covered. Impetigo, boils, folliculitis, carbuncles, etc. And other skin infections, bacterial infections, that's coming from the coniform bacteria, that is erythrasma. Erythrasma, it's a chronic localized infections by corneal minutismism. So always when a patient is coming with this, maybe we confused with the fungal infection or sometimes in such a case, flexural psoriasis and all. So examine the patient very clearly and then only go for the differential diagnosis. If it is flexural psoriasis, you can see minimum scaling from that particular area, minimal scaling. And in the case of fungal infections, very well demarcated margin of the fungi round in the round lesion. But in the case of bacterial infection, not much scaling, not much demarcated margin, but it will be sharp margin. It will be somewhat irregular, brown, and not much scale as you can see. Like this, the lesions can come. This is carbuncle, boil. This is also carbuncle. Multiple openings you can see. So in the case of pitaka, if pakkum, jaluka vajaranam you can give. Tilakalka lepam, godhuma lepam with the bilvadi gulika. And nimba single boil, you take nimbamradadi erandam, just heat it and with the use of a pipette. Or you can apply that on the particular area. It helps to break the pitaka. So all in the cases, you have to go with the Pitta Kapha line of treatment. Guluchadi Kashaya, Nide Tulasiadi Kashaya, Nimbadi Kashaya, Nimbasito Lamrata Chukku Varetamanyan Nimba, Nimba Barka, Guluji, that's Haridra, that's telling that Dehe Kurita Guru Verum Aranal the Pitakas, which forms in our body, it can be treated by the usage of 6 days. Puram, you have to add Puram, you have to add Gugulu into that, and you can use. Add with honey also. That is Nimbadi Kashayam. Nisha Katagadi Kashayam, actually it is told in Prameha, Nisha, Kataka, Amalaki, and it is Parandi Techi, Pachoti is Lodra. Nisha Kataka Nellika Techi Pachoti. So I started with the this Nisha Katagadi Kashayam. When you have Eganayaka Ramacham, Ebhikwadam, this in that Eganayakam and Ushiram is there. If we are this Nisha Katagadi Kashayam, you can use in the case of Pitakas. If we are adding this Nisha Katagadi Kashayam, condense that Nisha, Kataka, Nellika, Techi, Pachoti, Bhadrika, Ekanayaka, Ramacham. All other except Ekanayakam, all other in equal parts and equal amount, double the amount of Ekanayakam if you are adding, it's good for hydradendis suppurativa cases. I will see afterwards. So, Shundi, Bella, Nimba, Patola, Kushta, Dhanika, Amalaki, Kashayam. Good for the Farangal, good for the Carbuncle. Okay. And also, Khadira Tribhaladi Kashayam, which is explained in this Sahasra Yogam. That is also very good if the carbuncle or furuncle associated with the prameha. You can give that. Jivantyadi Kashayam and single drug Shatavari, just make a Kashaya, Shatavari tuber, make a Kashayam and we can give. Amalaki Swarasa added with the Sita and Madhu, good to control the Pitaka spreading and to control it become Paga. Patola, Kadarohini, Vasha, Mula, Nimba, Guluji, Parpadaka, Dusparsha, Brihadi. That's Kashayam is another Kashayam told in the Spitaka Prakaranam. Chandana, Parpada, Guduji, Ushira, Dhanya Kashayam. Again, another yoga. These all yogas you can use in the case of Pitakas to control it from spreading. Okay. And cutaneous abscess, cutaneous pus formation. All these kashayas you can see, and take Aragodadi kashayam for the Kshanana purpose. As I told, necrotizing fasciitis, aerobic and anaerobic bacteria causes this infection. Better to refer if it is in active stage. Like this, the patient may come to you. Again here, if the second, if the first stage or the third stage, after the healing, if it is coming, you can do the Pitta, Kabahara, Krimihara line of treatment. Nurgundyadi Kashayam, Pradidyaya Kashayam, Lucyadi Kashayam, Sudarshanam Guliga, Gugulu Panchabala Churna for controlling the infections. Gorojanadi controls the infections and reduces the pain. Avipatti Churna for the Nityavirejanam. Primikna Vadiga to control the micro growth, organism growth. Arogyavardhini Vadi to enhance the immunity of the patient. Okay. Sudarshana Churnam. Actually, it is Pitadika condition is Paitika Jwara, it is telling. And it is telling its Anupanam is Shida Jala only. So every churna you can give in hot water except to Sudarshana Churnam. As it is telling is Vidakta Vittavasda. Sudarshana Churnam should be given with the cold water. Shida Jala. Okay. So in the case of any of the infection, even it is viral, bacterial, fungal, anything you can give Sudarshana Churnam, intermittent jaundice, hepatitis, thyroiditis, any case you will get result. Weeping dermatitis, non-healing ulcers, impetigo, pemphigus, anything you can use Sudarshana Churnam to control the infections, to prevent the secondary infection also. Okay.